Imagine waking up one morning, feeling completely fine, but just as you go about your day, you begin to notice something isn't quite right. Perhaps it's a nagging discomfort while urinating, or maybe a sudden, unexplained pain in your lower back. You brush it off. After all, you're in your 50s and aches and pains come with age, right? But what if these signs were your body's way of telling you something more serious? Something that affects 1 in 7 men in the United prostate cancer is the second most common cancer among American men, and it has the potential to completely alter the course of your life. But here's the shocking part. In its earliest stages, prostate cancer can often show no symptoms at all. By the time you notice discomfort or experience other symptoms, the disease could be more advanced than you'd like to think. The harsh reality is, the moment you hear the word cancer, fear sets in. But the truth is, early detection is key. In this comprehensive guide, we're going to dive deep into the world of prostate cancer, an issue that should be at the forefront of every man's health conversation. We'll cover everything from how to recognize the subtle signs, the risk factors, and how you can prevent this devastating disease. You'll learn about the state-of-the-art treatments that can save your life, and some natural, holistic remedies that might be just as important in your journey to healing. Whether you've been diagnosed, or you're simply looking to protect yourself and the men you love, this guide will equip you with the knowledge and tools to face prostate cancer head-on. But here's the twist. Prostate cancer does not have to be a death sentence. In fact, when detected early, most men can survive and even thrive after treatment. Yes, there are challenges. Treatment can be taxing, both physically and mentally. But you don't have to go it alone. With the right diet, exercise, and support, you can not only fight prostate cancer, but defeat it. That's where Health for Tomorrow. In the coming sections, we will break down the myths, tackle the fears, and walk you through a journey of survival, hope, and thriving. This is not just a medical issue. It's a battle that can affect every part of your life. But with the right knowledge, you can make proactive choices that ensure a healthier tomorrow. Are you ready to learn how to take control of your prostate health and protect yourself from one of the most insidious diseases affecting men today? Let's get started. With Health for Tomorrow by your side, you're never alone in this journey.
Understanding prostate cancer, a silent threat. Prostate cancer, though one of the most common cancers affecting men, remains one of the least discussed health concerns in mainstream conversations. Often considered a silent disease, prostate cancer may not present any noticeable symptoms in its early stages, making it particularly difficult to detect until it has reached an advanced stage. This is why knowledge is your best weapon. The prostate is a small, walnut-shaped gland located just below the bladder and in front of the rectum. Its main function is to produce seminal fluid, which nourishes and transports sperm. It plays a vital role in reproduction, but it also becomes a critical part of men's overall health, especially when it becomes a breeding ground for cancerous cells. Prostate cancer occurs when abnormal cells in the prostate gland begin to grow uncontrollably. These rogue cells can form tumors that may spread to nearby tissues or, in more severe cases, metastasize, spread, to other areas of the body such as the bones or lymph nodes. How prostate cancer develops. Like many cancers, prostate cancer develops in stages. It usually starts as small, localized tumors within the prostate, and as it progresses, it can spread to adjacent organs or even enter the bloodstream, increasing the likelihood of metastasis. 1. Benign prostate hyperplasia, BPH. Before prostate cancer occurs, many men experience a non-cancerous condition known as benign prostatic hyperplasia. This condition involves the enlargement of the prostate gland, but does not involve the growth of cancer cells. However, BPH can cause similar symptoms to prostate cancer, like frequent urination or difficulty urinating. BPH does not increase your risk of prostate cancer, but may confuse early detection. 2. Local stage cancer. In its earliest stages, prostate cancer remains confined to the prostate gland. While small, these tumors are often slow-growing, meaning they may not show symptoms immediately. It's not until later stages, when the cancer begins to grow or spread, that problems such as pain or urinary issues become apparent. 3. Advanced cancer. As prostate cancer progresses, it can spread to nearby tissues or other parts of the body. This stage is called metastatic prostate cancer and is more difficult to treat. It can cause symptoms that include bone pain, weight loss, fatigue, and difficulty urinating. Risk factors. Who is most at risk? While no one is immune to prostate cancer, certain factors increase the likelihood of developing the disease. Understanding these risks is essential for prevention and early detection. Age. Prostate cancer is most commonly diagnosed in men over the age of 50. The risk increases significantly with age, and the majority of cases are found in men over 65. This is one reason why men are encouraged to begin regular prostate screenings in their 50s or earlier if they have other risk factors. Family history. A family history of prostate cancer can double your risk. If a father, brother, or other close relative has been diagnosed, your likelihood of developing prostate cancer increases. Genetic mutations can play a key role in this increased risk, and it is especially concerning when multiple family members have been diagnosed at a young age. Race and ethnicity. African American men are more likely to develop prostate cancer than any other racial or ethnic group. They are also more likely to be diagnosed at a younger age and with more aggressive forms of the disease. On the other hand, Asian and Hispanic men generally have a lower risk of prostate cancer, although they are not immune. Diet and lifestyle. Diets rich in red meat, dairy, and high-fat foods have been linked to an increased risk of prostate cancer. A lack of physical activity and obesity also contribute to a higher risk. Conversely, eating a diet high in fruits, vegetables, and healthy fats, like those found in fish and nuts, may reduce the risk. Hormones. Prostate cancer cells rely on male hormones, or androgens, to grow. Men with high levels of testosterone or those undergoing hormone therapy may have a higher risk, as the cancer may thrive on this hormone. This is why therapies that lower testosterone levels can be used to treat advanced prostate cancer. Understanding the stages of prostate cancer. Once diagnosed with prostate cancer, it's crucial to understand its stage and how far it has progressed. The stage of prostate cancer is determined by the extent of tumor growth and whether the cancer has spread to other parts of the body. The commonly used staging system is the TNM system, which stands for tumor, node, and metastasis. 1. T, tumor, refers to the size and extent of the tumor within the prostate. 2. N, node, indicates whether the cancer has spread to nearby lymph nodes. 3. M, metastasis, describes whether cancer has spread to other parts of the body, such as bones or distant organs. The more advanced the stage, the more aggressive the treatment plan becomes. Early-stage prostate cancer, stage 1 or 2, is often treated with surgery or radiation therapy, while advanced stage cancer, stage 3 or IV, may require more intensive treatments like hormone therapy, chemotherapy, or immunotherapy. Prostate cancer in the United States. The statistics. According to the American Cancer Society, prostate cancer is the second most common cancer diagnosed in men, with an estimated 1 in 8 men being diagnosed during their lifetime. It's projected that more than 248,000 new cases of prostate cancer will be diagnosed in 2025, and nearly 34,000 men prostate cancer often grows slowly, which means many men live with the disease without experiencing major health issues. In fact, 99% of men diagnosed with prostate cancer in the early stages survive at least 5 years after diagnosis. This makes early detection and proactive treatment critical. Prostate cancer may be a silent disease, but it's far from an inevitable one. With early detection, the right lifestyle choices, and a proactive approach to health, men can protect themselves from this deadly disease. Understanding how prostate cancer develops, who is most at risk, and what the signs and stages are can help you take the necessary steps toward prevention and early detection. In the next chapters, we'll explore how to recognize the warning signs, the importance of screenings, and the most effective prevention strategies. With this knowledge, you can make informed decisions to safeguard your health and ensure a brighter, healthier tomorrow. The silent early stages. How prostate cancer often goes unnoticed. Prostate cancer is often referred to as a silent disease because in its earliest stages, it rarely presents noticeable symptoms. This is one of the reasons why it's often diagnosed later than it should be, when the disease has progressed beyond its most treatable stage. The prostate, being located deep within the body, is not easy to detect without specialized screening tests. However, that doesn't mean there are no signs to watch for. The key to fighting prostate cancer lies in early detection. In many cases, prostate cancer grows very slowly, meaning it might not cause any symptoms for years. However, if left undiagnosed or untreated, it can eventually lead to more serious issues. In this chapter, we'll examine the warning signs, symptoms of advanced cancer, and why it's essential to be proactive about your prostate health. Early warning signs of prostate cancer. In the earliest stages, prostate cancer often presents no symptoms at all, which is why it is frequently diagnosed during routine screenings rather than due to physical signs. However, there are some subtle changes in your body that may indicate the onset of prostate problems, including cancer. While these symptoms are not necessarily a sign of cancer, they are worth noting and discussing with your healthcare provider. Frequent urination. One of the most common early signs is an increased need to urinate, particularly at night. This could be due to the growth of the prostate gland pressing against the bladder or urethra, causing frequent urges to urinate. Men may also experience difficulty starting or stopping urination. Difficulty with urination. If you find it challenging to begin urinating or experience weak or interrupted urine flow, this could signal that the prostate is growing larger or that a tumor is affecting the urethra. Prostate cancer may block the passage of urine, leading to discomfort or a sense of incomplete voiding. Pain or discomfort. During urination, a burning sensation or pain while urinating is another symptom that may suggest prostate cancer, although it is also common in less serious conditions like prostatitis or a urinary tract infection. If the pain is persistent and accompanied by other symptoms, it should be evaluated by a healthcare provider. Blood in urine or semen. If you notice blood in your urine, hematuria, or semen, hematospermia, this could be a sign of prostate cancer. While not necessarily indicative of cancer, this symptom requires immediate attention and testing to rule out any serious underlying conditions. Pain in the pelvic area or lower back. Prostate cancer may also cause discomfort in the pelvic area, lower back, or hips, particularly as it spreads to nearby bones. Pain or stiffness in these regions that doesn't go away may be a sign that the cancer is advancing. Erectile dysfunction. Difficulty achieving or maintaining an erection can sometimes be an early sign of prostate cancer, particularly if the cancer has spread to nerve-rich areas surrounding the prostate. Though erectile dysfunction can be caused by many factors, including aging or stress, it should not be ignored if it is persistent. Advanced symptoms of prostate cancer. As prostate cancer progresses, the symptoms may become more pronounced and severe, signaling that the cancer has spread beyond the prostate. If you experience any of the following, it's important to seek medical attention immediately. Bone pain or fractures. Prostate cancer often metastasizes to the bones, particularly the hips, spine, and pelvis. If cancer spreads to the bones, it can cause significant pain and, in severe cases, fractures. This type of pain is often persistent, and worsens over time. Unexplained weight loss. Sudden and unexplained weight loss, especially when accompanied by a decrease in appetite, can be a sign of advanced prostate cancer. As cancer cells consume energy, the body's metabolic functions can be disrupted, leading to unintentional weight loss. Fatigue. As prostate cancer progresses, men may experience extreme fatigue that is not relieved by rest. This is often due to the body's immune response to cancer or the effects of treatment. Fatigue can make even simple daily activities feel exhausting. Swelling in the legs or pelvic area. Lymphedema or swelling in the legs can occur when prostate cancer spreads to the lymph nodes. This blockage of lymphatic fluid can cause noticeable swelling, especially in the lower extremities. Loss of appetite and nausea. As the cancer progresses and spreads, men may experience nausea, loss of appetite, and general discomfort in the stomach area. This can be a sign that the cancer has impacted other organs or that treatment side effects are causing digestive disturbances. The importance of recognizing symptoms. Early. While prostate cancer can be a slow-growing disease, early detection significantly increases the chances of successful treatment. This is why recognizing any potential symptoms and discussing them with your healthcare provider is crucial. Even though some of the symptoms may point to other health conditions, it's important to get a thorough evaluation to rule out prostate cancer or catch it early when it is most treatable. The prostate-specific antigen, PSA test, is one of the most common screening tools for detecting prostate cancer. Men who are at higher risk, such as those over the age of 50, those with a family history of prostate cancer, or African American men, should consider discussing PSA testing with their doctors as part of their regular health checkups. When to seek medical advice. If you experience any of the following symptoms, it's time to consult a healthcare provider. Frequent urination or difficulty urinating, especially at night. Blood in the urine or semen. Persistent pelvic, back, or hip pain. Erectile dysfunction that doesn't resolve. Unexplained weight loss or extreme fatigue. Swelling in the legs or pelvic area. Even if your symptoms are mild, it is always better to be proactive. Remember, early detection is the key to managing prostate cancer effectively and improving survival rates. The signs and symptoms of prostate cancer can be difficult to identify, especially in the early stages when the disease may not cause any noticeable discomfort. This is why regular screenings and being aware of changes in your health are essential. By recognizing the warning signs and seeking medical advice, you can detect prostate cancer early when it is most treatable. As we move forward in this guide, we will delve into the diagnostic tests and procedures used to confirm prostate cancer and explore the most effective treatment options available today. The goal is clear. Early detection and proactive care can save lives. The importance of early detection. Prostate cancer is one of the few cancers that can be detected early through routine screenings, which is a crucial advantage for men. While many other cancers have no specific early symptoms, prostate cancer often shows signs before it becomes more advanced, making early detection a key factor in improving outcomes. Once prostate cancer is suspected based on symptoms or risk factors, the next step is a series of diagnostic tests. These tests will help determine whether the prostate cancer is present, its stage, and its aggressiveness. Understanding the process of diagnosis is essential because it allows you to make informed decisions about your next steps in treatment and care. In this chapter, we'll walk you through the primary diagnostic tools for prostate cancer and explain how they work. We'll also discuss the importance of screenings and how they can save lives by catching prostate cancer in its most treatable stages. 1. Screening tests. Prostate-specific antigen, PSA, test. The prostate-specific antigen, PSA, test is one of the most common and widely used screening methods for prostate cancer. PSA is a protein produced by the prostate gland, and its levels can be measured through a blood test. An elevated PSA level doesn't necessarily mean cancer. It could also indicate benign conditions like benign prostatic hyperplasia, BPH, or prostatitis. However, it is often the first indicator that further testing is needed. PSA test and prostate cancer risk. The PSA test is typically recommended for men over the age of 50, especially those with a family history of prostate cancer or other risk factors. For men at higher risk, African American men or those with a family history, the test may begin earlier, around the age of 40 to 45. How the test works. The PSA test measures the level of PSA in your blood. Normal PSA levels typically range from 0 to 4 ng/ml. Higher levels, such as 4 ng/ml or higher, may suggest the presence of prostate cancer, though other conditions can cause elevated PSA levels. As PSA levels increase, the likelihood of prostate cancer also increases, but a higher PSA level doesn't always confirm a cancer diagnosis. Limitations of the PSA test. Despite its usefulness, the PSA test has limitations. It cannot definitively distinguish between aggressive cancer and slow-growing tumors that may never cause harm. Additionally, some men with prostate cancer may have normal PSA levels, so the test is only a first step in the diagnostic process. 2. Digital rectal exam, DRE. The digital rectal exam, DRE, is another important diagnostic tool used to evaluate the prostate for abnormalities. During this exam, a doctor will insert a gloved, lubricated finger into the rectum to feel the prostate for any irregularities, such as lumps or hard areas. Why the DRE is important. While the DRE is not as accurate as the PSA test, it can help detect larger tumors in the prostate. In some cases, a doctor may feel an abnormality that prompts further tests, such as a biopsy. A DRE is typically performed alongside the PSA test, providing additional information about the health of the prostate. How the DRE is performed. The DRE exam is quick and usually takes only a few minutes. The patient will be asked to bend over or lie on their side. The doctor will insert a lubricated finger into the rectum to feel for any lumps or abnormal texture in the prostate. Although the procedure may feel uncomfortable, it is not usually painful. Limitations of the DRE. The DRE is less sensitive than the PSA test in detecting prostate cancer and is not capable of detecting early-stage cancer in many cases. Therefore, it is typically used in combination with other tests for a more accurate diagnosis. 3. Prostate biopsy, the definitive diagnosis. If the PSA levels are elevated, or if the DRE exam reveals abnormalities, the next step is often a prostate biopsy. A biopsy is the most reliable way to confirm whether prostate cancer is present. How a prostate biopsy works. A prostate biopsy involves taking small tissue samples from the prostate using a needle. These samples are then examined under a microscope to look for cancerous cells. The procedure is usually performed using a transrectal ultrasound, TRUS, which helps guide the needle to the correct location in the prostate. When is a biopsy necessary? If a DRE or PSA test raises concerns, your doctor will likely recommend a biopsy. It is also used to determine the Gleason score, which evaluates the aggressiveness of the cancer. This score helps doctors decide the best course of action for treatment. What to expect during a biopsy. The procedure is typically done in a doctor's office or an outpatient setting. Local anesthesia is used to numb the area, and patients may be given antibiotics beforehand to reduce the risk of infection. Although the biopsy is generally safe, some discomfort, bleeding, or infection may occur afterward. Understanding the results. The biopsy will reveal whether cancer is present in the prostate, its aggressiveness, based on the Gleason score, and how much of the prostate is affected. A higher Gleason score indicates a more aggressive form of cancer that requires more intensive treatment. 4. Imaging tests. MRI and CT scans. Once prostate cancer is diagnosed, additional tests may be needed to determine the extent, stage, of the disease. Imaging tests help determine if the cancer has spread to other parts of the body. Magnetic resonance imaging, MRI. MRI uses magnetic fields and radio waves to create detailed images of the prostate. This test is especially useful in detecting tumors in the prostate and surrounding tissues. An MRI can also be used to guide the biopsy and determine whether cancer has spread to nearby tissues or organs. CT scans, computed tomography. A CT scan uses X-rays to create cross-sectional images of the body. This test helps detect the spread of cancer to the lymph nodes and other distant organs like the lungs or liver. It is often used in staging prostate cancer and determining the best treatment approach. Bone scans. If prostate cancer is suspected to have spread to the bones, a bone scan is used to identify areas where cancer may have metastasized. This is especially important if the patient is experiencing bone pain or has elevated PSA levels. 5. Genetic testing and personalized medicine. Genetic testing is an emerging field in prostate cancer diagnosis. Certain genetic mutations or hereditary factors may increase the risk of developing prostate cancer. Understanding these genetic markers can help determine the best treatment options for patients. BRCA, gene mutations. Men with BRCA1 or BRCA2 gene mutations, which are commonly associated with breast cancer, may also be at a higher risk for prostate cancer. Genetic testing can identify these mutations and help inform treatment decisions, including whether a patient is a candidate for specific therapies like PARP inhibitors. Targeted therapy. Genetic information can also be used to determine which treatments may work best for a specific patient. Targeted therapies aim to treat the cancer by attacking specific genetic changes that are driving the growth of the tumor. The diagnosis of prostate cancer involves a combination of tests, including the PSA test, DRE, biopsy, and imaging studies, all of which work together to confirm the presence of cancer, determine its stage, and guide treatment options. The earlier prostate cancer is detected, the more effective the treatment options, which is why understanding the diagnostic process and getting regular screenings is crucial. In the next chapter, we will explore the treatment options available for prostate cancer, from conventional methods like surgery and radiation to emerging therapies that offer hope for advanced cases. With early detection and the right treatment, prostate cancer does not have to be a life sentence. It can be treated, managed, and even overcome. The power of prevention. Proactive steps to protect your health. Prostate cancer is one of the most common types of cancer affecting men. But the good news is that there are significant steps you can take to reduce your risk and even prevent it altogether. While some risk factors, like family history or age, are beyond your control, lifestyle choices. This chapter will explore the preventive strategies that are supported by scientific research, focusing on dietary habits, physical activity, and lifestyle changes that can lower your risk. We'll also look at how screening tests, early detection, and a proactive health approach can make all the difference in staying ahead of this disease. 1. Diet and nutrition. The foundation of prostate health. What you eat plays a crucial role in maintaining a healthy prostate. Research has shown that a diet rich in certain nutrients can help protect against prostate cancer, while others may increase your risk. The right foods can reduce inflammation, fight oxidative stress, and even regulate hormone levels, factors that can all impact prostate health. Foods to eat. Tomatoes. One of the best foods for prostate health is tomatoes. They contain lycopene, an antioxidant that has been linked to a reduced risk of prostate cancer. Studies suggest that men who consume tomatoes regularly may have a lower risk of developing prostate cancer. Lycopene is most beneficial when tomatoes are cooked, so consider adding cooked tomato-based sauces and soups to your diet. Berries. Rich in antioxidants, blueberries, strawberries, and blackberries can help fight oxidative stress and inflammation in the body. These berries are packed with vitamins and minerals, particularly vitamin C, which is important for immune health and reducing cancer risk. Green tea. Known for its antioxidant properties, green tea is a great addition to a prostate-healthy diet. It contains catechins, which have been found to have anti-cancer effects. Drinking 1 to 2 cups of green tea daily may help lower prostate cancer risk and improve overall health. Cruciferous vegetables. Vegetables like broccoli, cauliflower, and Brussels sprouts contain compounds like sulforaphane that have shown promise in reducing the development of cancerous cells. These vegetables are rich in fiber, vitamins, and antioxidants, all of which contribute to better prostate health. Healthy fats. Omega-3 fatty acids found in fatty fish such as salmon, mackerel, and sardines have anti-inflammatory properties and may lower the risk of prostate cancer. These healthy fats can help balance hormones and reduce inflammation, which plays a role in cancer development. Foods to avoid. Red and processed meat. Diets high in red meat and processed meats like bacon, sausages, and hot dogs have been linked to an increased risk of prostate cancer. These foods can increase the body's levels of insulin-like growth factor, IGF, a protein that can stimulate cancer cell growth. Reducing your intake of these meats can lower your risk. High-fat dairy products. While dairy products like milk and cheese are important sources of calcium, excessive consumption, especially of full-fat dairy, may increase prostate cancer risk. Some studies have suggested that high calcium intake can lead to the development of more aggressive prostate cancers. Sugar and refined carbohydrates. Diets high in sugar and refined carbs, such as white bread and pasta, can lead to obesity and insulin resistance, both of which increase cancer risk. Instead, focus on whole grains and fiber-rich foods, which can stabilize blood sugar levels and support overall health. 2. Exercise and weight management. Staying active for prostate health. Regular physical activity is one of the most effective ways to prevent prostate cancer and improve your overall health. Men who maintain a healthy weight and stay active are less likely to develop prostate cancer than those who lead sedentary lives. Benefits of exercise. Reduces inflammation. Chronic inflammation has been linked to a variety of cancers, including prostate cancer. Regular exercise helps lower inflammation in the body by boosting the immune system and promoting the circulation of anti-inflammatory cytokines. Improves hormonal balance. Exercise can help regulate hormones like testosterone, which is crucial in prostate health. Lowering excess testosterone levels can reduce the chances of cancerous growth in the prostate. Prevents obesity. Being overweight or obese is a major risk factor for many types of cancer, including prostate cancer. Excess body fat can lead to higher levels of insulin and other hormones that promote cancer growth. Maintaining a healthy weight through exercise can significantly reduce this risk. Exercise recommendations. Aim for at least 150 minutes of moderate aerobic activity per week, like brisk walking or cycling, combined with strength training exercises twice a week. Resistance training, using weights or bodyweight exercises, is especially beneficial for increasing muscle mass and boosting metabolism. Types of exercise for prostate health. Aerobic exercise. Activities like walking, jogging, swimming, and biking can improve cardiovascular health, help maintain a healthy weight, and increase energy levels. These exercises also improve blood flow, which is important for prostate function. Strength training. Lifting weights or performing bodyweight exercises like squats and push-ups can help reduce body fat, build muscle mass, and increase testosterone metabolism, which may contribute to a healthier prostate. Pelvic floor exercises. Kegels. Kegel exercises, which strengthen the pelvic floor muscles, can help improve urinary control and sexual function. These exercises may be beneficial for men at risk of prostate cancer as they help maintain pelvic health and function. 3. Limiting alcohol and avoiding tobacco. Alcohol consumption. Excessive alcohol consumption has been linked to several types of cancer, including prostate cancer. While moderate alcohol intake, 1 drink per day, is generally considered safe for most men, excessive drinking can impair the immune system and increase cancer risk. Limiting alcohol consumption is an important part of a prostate-healthy lifestyle. Tobacco use. Smoking is one of the leading causes of cancer, and it is associated with an increased risk of prostate cancer, especially in younger men. Quitting smoking can significantly lower the risk of prostate cancer and improve overall health. If you are a smoker, seek support to quit as soon as possible. 4. Regular screenings. One of the most powerful preventive tools for prostate cancer is regular screening. Early detection through PSA tests and DRE exams can help catch prostate cancer at its most treatable stages, often before symptoms appear. When to start screening. The American Cancer Society recommends that men at average risk begin discussing screening with their healthcare provider at age 50. Men at higher risk, such as those with a family history of prostate cancer or African American men, should begin screening earlier, typically around age 40 or 45. Proactive health management. Even if you're not experiencing symptoms, regular checkups and screenings are essential to detect prostate cancer early. Early-stage prostate cancer often has a high survival rate when treated promptly. 5. Stress management. Chronic stress has been linked to a variety of health problems, including an increased risk of cancer. Learning how to manage stress effectively can have significant benefits for prostate health and overall well-being. Mind-body practices. Meditation, yoga, deep breathing exercises, and mindfulness can reduce stress, improve mental clarity, and enhance the immune system. These practices can also help lower blood pressure and regulate the hormones that are linked to cancer development. Adequate sleep. Getting 7 to 8 hours of quality sleep per night is essential for maintaining a healthy immune system. Poor sleep is associated with increased levels of stress and hormones that promote inflammation and cancer growth. While there is no surefire way to prevent prostate cancer, adopting a healthy lifestyle can significantly reduce your risk. By focusing on a balanced diet rich in antioxidants, healthy fats, and nutrient-dense foods, maintaining an active lifestyle, managing your weight, and getting regular screenings, you can protect your prostate and take control of your health. In the following chapters, we will explore treatment options for prostate cancer, including both conventional therapies and natural remedies that can help you live a healthier life. Remember, the best defense against prostate cancer is a proactive approach to your health. Start today for a healthier tomorrow. A guide to standard treatment options. When diagnosed with prostate cancer, the treatment plan will depend on several factors, including the stage of the cancer, its aggressiveness, the patient's overall health, and personal preferences. Thankfully, prostate cancer has a high survival rate when detected early, and there are several effective treatment options available today. In this chapter, we'll explore the most commonly used conventional treatments for prostate cancer, including surgery, radiation therapy, hormone therapy, and chemotherapy. We'll break down how each treatment works, its benefits and side effects, and when they are typically recommended. Understanding your options will help you make informed decisions about the course of treatment and the best path forward for your health. 1. Surgery. The prostatectomy option. Prostatectomy is one of the most common treatments for prostate cancer, particularly for patients whose cancer is confined to the prostate gland. During this procedure, the surgeon removes the prostate gland and some of the surrounding tissue, including the seminal vesicles, where sperm are stored. In some cases, nearby lymph nodes may also be removed to determine if the cancer has spread. Types of prostatectomy. Radical prostatectomy. This is the most common form of prostate cancer surgery. It involves the complete removal of the prostate gland. There are two main types of radical prostatectomy. Open radical prostatectomy, a traditional surgery in which a large incision is made in the lower abdomen to remove the prostate. Laparoscopic prostatectomy, a minimally invasive surgery in which small incisions are made, and a robotic system or camera is used to assist in the removal of the prostate. Robotic-assisted surgery. Robotic-assisted prostatectomy has become increasingly popular due to its precision and the ability to minimize blood loss and recovery time. Surgeons use a robotic system with a camera to remove the prostate with smaller incisions. When is surgery recommended? Surgery is typically recommended for patients with localized prostate cancer, stage 1 or 2, where the cancer has not spread beyond the prostate. It is especially effective when the cancer is confined to one area of the prostate. Pros and cons. Benefits: high success rate, especially when the cancer is localized, can provide definitive results by completely removing the tumor. Risks and side effects. Incontinence. Some men may experience difficulty controlling urination after surgery, though this often improves with time and physical therapy. Erectile dysfunction, ED. Damage to nerves around the prostate can cause temporary or permanent erectile dysfunction. Infection and blood clots. As with any surgery, there is a risk of infection or blood clots, particularly with open surgery. Recovery time. Recovery after prostatectomy varies depending on the type of surgery. For robotic-assisted surgery, recovery may take several weeks, whereas recovery from open surgery can take up to 8 weeks or more. Most men can resume normal activities within 1 to 2 months. 2. Radiation therapy. Targeting tumors with precision radiation. Therapy uses high-energy radiation to kill cancer cells or stop them from growing. It is often used as a primary treatment for prostate cancer or as an adjuvant therapy after surgery, especially if there are concerns that cancer cells may remain in the body. There are two main types of radiation therapy for prostate cancer. External beam radiation therapy, EBRT. How it works. EBRT delivers targeted radiation from outside the body using a machine called a linear accelerator. The patient lies on a treatment table while the radiation is directed precisely at the prostate. When is it recommended? EBRT is typically used for localized prostate cancer or when cancer has spread to nearby tissues but is still confined to the prostate area. It can also be used after surgery to kill remaining cancer cells. Brachytherapy, internal radiation therapy. How it works. Brachytherapy involves placing small radioactive seeds directly into or near the prostate tumor. These seeds deliver a concentrated dose of radiation to the cancer cells over time. When is it recommended? Brachytherapy is often recommended for men with smaller, localized tumors. It can also be used in combination with EBRT for more advanced cases. Benefits and side effects. Benefits: effective for localized cancers or as an adjunct to surgery. Less invasive than surgery. Can be completed on an outpatient basis, meaning the patient does not need to stay in the hospital. Side effects. Fatigue. Many patients report feeling tired after radiation therapy. Urinary problems. Radiation can irritate the bladder, leading to frequent urination, urgency, and discomfort. Bowel issues. Radiation can cause rectal irritation, leading to discomfort or changes in bowel movements. Erectile dysfunction. Some men may experience difficulty achieving or maintaining an erection after radiation therapy. Recovery time. Recovery from radiation therapy varies depending on the type and the individual. Most side effects will subside over time, though some men may continue to experience long-term effects, such as erectile dysfunction or bladder issues. 3. Hormone therapy. Controlling testosterone levels. Hormone therapy, also known as androgen deprivation therapy, or ADT, is used to reduce or block the production of testosterone, a male hormone that can fuel the growth of prostate cancer cells. Since prostate cancer cells often rely on testosterone to grow, reducing its levels can slow or stop the progression of the disease. How hormone therapy works. Hormone therapy is not a cure for prostate cancer, but it can shrink tumors or slow their growth. There are several approaches. LHRH agonists, drugs such as Leuprolide, Lupron, and Goserelin, Zoladex, lower testosterone by blocking signals from the brain to the testes. Anti-androgens, drugs like flutamide or bicalutamide block testosterone from binding to cancer cells, inhibiting their growth. Orchiectomy. In rare cases, the surgical removal of the testes, orchiectomy, is performed to eliminate the primary source of testosterone production. When is hormone therapy recommended? Hormone therapy is typically used for advanced prostate cancer, stage 3 or IV, or in cases where the cancer has recurred after surgery or radiation. It is also used to reduce tumor size before radiation therapy. Benefits and side effects. Benefits: can significantly shrink or slow the growth of prostate cancer. Can be used in combination with other therapies, such as radiation or chemotherapy, for better results. Side effects: hot flashes. Many men report experiencing hot flashes, similar to those experienced by women during menopause. Weight gain and reduced bone density. Long-term hormone therapy can lead to weight gain and a decrease in bone density, increasing the risk of fractures. Erectile dysfunction, a common side effect of lowering testosterone levels. Mood changes. Some men may experience mood swings, irritability, or depression. Recovery time. Hormone therapy is a long-term treatment that may require periodic monitoring. While the effects of hormone therapy are generally reversible after stopping treatment, some side effects, such as bone density loss, may require ongoing management. 4. Chemotherapy, targeting advanced cancer. Chemotherapy uses powerful drugs to kill fast-growing cancer cells throughout the body. It is typically reserved for prostate cancer that has spread beyond the prostate, or when hormone therapy is no longer effective. How chemotherapy works. Chemotherapy drugs are usually administered through an intravenous IV infusion or oral medications. These drugs circulate through the bloodstream, attacking cancer cells that have spread to other organs or tissues. Since chemotherapy also affects healthy cells, it can cause significant side effects. When is chemotherapy recommended? Chemotherapy is typically recommended for patients with metastatic prostate cancer or those whose cancer has become hormone-resistant, refractory prostate cancer. It is often used when the cancer no longer responds to hormone therapy. Benefits and side effects. Benefits. Chemotherapy can be highly effective at controlling the spread of cancer and alleviating symptoms associated with metastatic disease. Side effects. Fatigue. One of the most common side effects of chemotherapy. Hair loss. Many men experience hair loss, although it's typically temporary. Nausea and vomiting. Chemotherapy can affect the digestive system, causing nausea, vomiting, and loss of appetite. Low blood counts. Chemotherapy can reduce the number of red blood cells, white blood cells, and platelets, leading to an increased risk of infection and fatigue. Recovery time. Chemotherapy typically involves several cycles of treatment, with periods of rest in between. Recovery time varies depending on the type of chemotherapy and individual tolerance. Most side effects subside after treatment ends. Conventional treatments for prostate cancer, surgery, radiation therapy, hormone therapy, and chemotherapy offer a range of options for men at various stages of the disease. The choice of treatment depends on many factors, including the cancer stage, the patient's overall health, and the goals of treatment. While each treatment comes with its own benefits and potential side effects, The key to successfully managing prostate cancer is early detection and personalized care. In the next chapters, we will explore natural treatment options and lifestyle changes that can complement conventional therapies and further support prostate health.